some, oh, there we go. We put some counselling services in case, yeah, you have been impacted by anything today. And just at the end of the Q&A, if you can keep the questions more general so you don't bring up specific incidences of abuse that might be triggering to some people. But yeah, that's about all. I might hand over to you, Liz, to crack on with the presentation.
Thank you, Bridget. So a bit of basically who we are. So we've got myself as the Disability Royal Commission Project Officer with Aged and Disability Advocacy Australia. We've got Bridget, who you've already met. She's one of our disability advocates and she works with the North Brisbane area, but she's also been working with us on the Disability Royal Commission. And then we have our fabulous Sarah Ward, who's our Disability Royal Commission advocate on the Gold Coast. So Sarah basically works with our clients directly. We also have Rebecca Kenafay, who's the Disability Royal Commission advocate in Central Queensland. So she works from the Rockhampton office. And we also have Ben Shaw, who's our disability advocate and Disability Royal Commission advocate for Central Queensland. Again, he's based in the Rockhampton office. We also have Emad, who is our lovely culturally and linguistically diverse engagement officer. So Emad is in our session today. So Emad, if you just want to have a quick shout out.
Hello, everyone.
Thank you, Emad.
Yep.
So before I continue, I would just like to acknowledge the traditional custodians of the land, paying respects to elders past, present, and those that are still emerging. I understand we're gathering from many, many different locations. So there's many different traditional custodians that we're acknowledging today. Just moving on, the main point of this webinar is to give you some information about the Disability Royal Commission. It's also to help you understand the support that ADA Australia can provide and the services in the region there. We're also going to cover off some frequently asked questions from clients, but also from our education sessions that we've been running from peer support groups and when we've been engaging organisations directly. And then finally, we'll just open up the floor for question and answers. So if you just want to pop them in the chat, we can answer them as we go, or alternatively, if you don't want to share the questions or don't feel comfortable sharing the questions, you can email myself directly and I'll respond to you and I'll have my details up at the end there. So just a bit about ADA. So ADA Australia was QADA, so Queensland Aged and Disability Advocacy Australia, and we started in 1991. We have office locations throughout Queensland, but for the Disability Royal Commission project, we're mostly working from the Buranda offices, the Varsity Lake offices and our Rockhampton offices, as well as our Geebung office as well. With our services, we offer advocacy for aged care, disability. We also do systemic advocacy. So systemic advocacy is where we as an organisation put submissions forward on various issues. For example, if there's policy consideration or changes in legislation that we can see will create an issue with a process there. We also have education sessions. Some are free, some are charged. We also can provide free resources upon request to anyone who would like them. And then lastly, we've got an ADA law clinic. So this is a very recent legal clinic that's opened up and they can help with human rights support, a bit of legal support and a bit of advocacy. So in that, they're looking at enduring power of attorney, QCAT orders, Office of Public Guardian, Office of Public Trustee. They also have the assistance and advocacy for elder abuse as well. And they also help with mental health tribunal review as well. So that's our services in a nutshell there. With regards to the DRC, or the Disability Royal Commission, was established in April 2019. The reason why it was established is the community started to respond to widespread reports of violence, abuse, neglect, and exploitation of people with a disability. And the Disability Royal Commission is basically looking at gathering information. How they gather information is by people such as yourselves sharing your experience or stories through issue papers, which are very targeted on particular topics with very set questions. And then they have what we call public hearings. Public hearings go more in depth than the issue papers. So at the moment with the Royal Commission, there are approximately 6 commissioners, and the Royal Commission is looking into a variety of barriers individuals have faced. So what does that mean? It means it's quite wide in what you talk to the Royal Commission about, and I'll get into that a little bit further. So as of the 30th of October last year, an interim report was delivered to the Royal Commission on submissions and issue papers on topics that were researched at that point. And then lastly, what will happen is a final report will be delivered in September 2023. In that final report, that report is recommendations that they're putting to the government based on their findings from people sharing their experience or story with the Commission, public hearings, and also issue papers. And just for reference there, I have listed the website www.disability.royalcommission.gov.au if you'd like to explore their website further. And moving on, so when we're talking about the Disability Royal Commission, there are 4 key terms that the Commission has highlighted with a very simplistic understanding of what they mean. So when they're talking about abuse, it's when someone is treating you badly. When we're talking about violence, it's when someone is hurting you physically. Neglect is when someone is not helping you the way they should be. And exploitation is taking advantage of you. So for example, a good example I have of exploitation is a client who I've been working with on and off for approximately 12 months now. They were registered to receive services and they were being charged for services that were not actually happening. So in that instance, that person was being exploited financially because they knew that that person needed the service but wasn't getting the service or support they needed. So that's just one example of exploitation there. And there are many more examples. So with the Disability Royal Commission, it's really important that we let you know that they do not help resolve individual disputes. They will not fix or award compensation, and they don't make orders to take action or not to take action. So the Royal Commission is purely about seeking information from people about what's been happening with them, also putting forward recommendations. They are completely separate from the judicial system. So that means that they can't really get involved with any legal matter there. So with regards to the government, the Royal Commission, and where non-for-profit organisations or non-government agencies sit, we have the Australian government who formed the Royal Commission, but the Royal Commission sits separate. They report back to the Australian government about their findings. Now, with our non-for-profit organisations or non-government organisations, we're basically engaged to help people share their experience and story with the Royal Commission. So for example, we've got Blue Knot Foundation micro projects. These are our counselling services that can help support people when they're sharing their experience or story. Then we've got Your Story Disability Legal, who fit into this. Your Story Disability Legal is about giving the option to seek legal advice and to see if there's any conflicts when sharing their story, but also give people an option to find out if they need further legal advice on the matter. And then you have agencies like ADA Australia, who we are primarily here to help you share your story in your own words and get it to the Royal Commission so it forms part of their research and their findings. When we're sharing or encouraging you to share your experience and your story, it's really important that you understand that it is your voice and it's your experience. And myself, no one else can take that away from you. So when you're sharing your story, it could be anything that had happened to you. It could have happened at school. It could have happened in the workplace. So for example, are you currently employed and the employer is putting pressure on you because of your disability? So for example, if you need to take some time off due to mental health, is the employer pressuring you, saying you're taking too much time and threatening you and putting you on a performance improvement plan? So that's an example of where you can share your experience and your story about what it's like in that instance for you and the pressures that have happened. It can also happen to people in prisons. We encourage people to talk about group homes, boarding homes, or family homes where they've experienced any kind of violence, abuse, neglect, or exploitation. There's also instances where people have had problems with the hospital, and we still encourage people to come through and talk to us. But also, if you've had an issue in the community broader, for example, have you been denied entry for some reason because either you have an assistance dog and people don't understand that assistance dogs can enter this place, or you're not unable to access a facility because it's not disability friendly, for example, no lifts, or if you rely on a wheelchair or motorized scooter. The other important thing is that it doesn't matter how long ago it happened. It could have happened 5 minutes ago, or it could have happened a long time ago. The Royal Commission understands that people with a disability are at various stages in their life, and it's not restricted to one age gap. It's everybody. So they're encouraging people, even if it's happened 30 or 40 years ago, to please come forward and still share your experience and your story. And the important thing is that by sharing your experience and your story, you're having it heard and you're having it acknowledged. And through that, you're raising awareness and helping to put recommendations for change, for an inclusive society. So basically, once we've got to this point, I guess the question is, who should or can share a story? The important thing is that anyone can share a story, the individual themselves. You don't need to have a formal clinical diagnosis. You don't necessarily need to have a disability. Your disability could be temporary. It doesn't matter. They'd like to hear from everybody. The other point is that we do understand, and the Commission understands, that there are people who can't communicate. So, for example, people who are nonverbal, how do they communicate? People who have children who have disabilities. The Royal Commission understands that, and that's why they encourage the fact that support workers, family members can make a submission or share their experience on behalf of an individual. And lastly, the biggest part is organisations. Organisations need to step forward and share with the Royal Commission what they're seeing. So, for example, organisations can make systemic submissions about the NDIS. So the NDIS with regards to applications being refused, funding, if that's a massive issue, which I do believe it is. So these are just some examples organisations can make submissions about, But more importantly, the individuals and their family members or carers can share a story about what's happened to that person. So why should you share your story? Well, sharing your story helps the Royal Commission learn about the problem. It helps them to understand it and try and prevent it in the future. It also helps them to try and understand the extent of the problem. Is the issue or problem at an individual level, or is it a problem that's with a process, or is it a problem that needs to be addressed in the community more broadly? The other thing is that by everyone sharing their story, the Commission can learn about the context in which it's occurring. So is it occurring in schools? Is it occurring in the workplace? Is it occurring because there's just not enough information and, there's more that needs to be done about it? And another reason why you should share your story is it's really important to understand how it impacts people themselves with the disability, their family members, their support people, and their community. So, for example, it's important to understand that brothers, sisters, mothers, aunts do feel it. But it's also important that sometimes you have support workers who work in the community and work with people with a disability, and they find that the system might be very frustrating. And that's important that that gets shared. Again, like I've already said, it helps gather information to form further investigations. So the more people share their stories, the more opportunity there is to investigate the matter further. And lastly, and most importantly, it's to help make recommendations for people for the future from preventing it from happening again, which is really important because we want this to stop and we need to share as much as we can so we can help it stop. Another kind of question we come across is, well, will I get into trouble for sharing my story? It's absolutely important for everyone to understand that no one will get in trouble when they share their story with the Disability Royal Commission. If you're concerned, there's Your Story Disability Legal, who offers free and independent legal advice. So they can help you identify if there's any legal matters and get the assistance you may need. Another important thing is that the confidentiality amendments mean that some certain information will remain fully confidential. So what that means is if you mark your submission as private, confidential, or restricted, this will stop information from being shared with other people through freedom of information requests. What that also means is that the open access, so that means when a person requests freedom of information, they can only request that information and that will be released after 99 years. It's also important to note that with this new confidentiality amendment, it will be retrospectively applied to submissions that have already been made to the Royal Commission that have been marked restricted or confidential. So that means you're getting that extra support if you're worried about people finding out you sharing your story or information or your situation about what you've experienced. A big thing a lot of people ask is, well, what can I talk about? You can talk about any barriers you've faced or experienced anywhere, like I said before. So for example, the ones here on the PowerPoint slide are just a few, but also quality safeguards, group homes, education, restrictive practices, and emergency planning and responses. These are examples of people who have submitted and shared their story so much that they created an issue paper specifically to address particular questions around what was happening. So for example, in emergency planning and response, there's questions aimed at how has COVID-19 impacted you with getting access to support? That's just an example of one question. We then have the restrictive practices issue paper, where it discusses the different types of restrictive practices. So for example, is it chemical restraint? So that means, are they using medication on you? Are they using environmental factors, so locking you in a room? The quality and safeguards issue paper is talking primarily about the NDIS. However, it also encourages other quality and safeguard commissions, such as the Health Commission as well. We've also understood that a lot of people are talking about their experience in group homes and the fact that they've been hurt, they've been neglected, or something's happened in group homes. So that's an issue paper. There's also been instances with the education system. So education, we're talking from early childhood, primary and secondary school, and right through to accessing tertiary education. So that's really important. The fact that people are facing disabilities, accessing education at so many different levels. You can also talk about the healthcare system. So the struggles you have with the hospitals. You can also talk about Centrelink or Veteran Affairs or Medicare. So Centrelink, are you having problems applying for and accessing the disability support pension? Are you having problems with the forms? Are you experiencing a lot of pushback? When you phone up and speak to Centrelink, Veteran Affairs or Medicare, are you told that it should be done online, but you go online and find that it can't be done online and you have to go in person, but you're repeating the cycle? So these are just a few examples of what you can talk about. It's not limited. Another question we come across is, will the Disability Royal Commission mean real changes happen? It's important to understand that the more stories or experiences you share about the same issue, it ensures that awareness is actually raised. Another thing is that speaking up can lead to ongoing change and support from advocacy organisations such as ADA Australia. Recommendations from stories and from the Commission will be put forward to the government. However, it's at the government's discretion whether they choose to take on board and use those recommendations and start implementing changes. But this is the whole point, is that by making sure you can get the advocacy agencies on board, it will lead to ongoing push for changes for that. A lot of questions we get are around, what do you get or what do you take away from when speaking with an advocate? So it's important to understand that everyone is an individual and it will never ever be the same for everyone. So there'll be an individual experience and benefit for each and every case, because each and every case is unique and different. For some people, they want to have their experience heard and to be on record, and that's enough. For other people, they want to name and shame service providers. And again, that's where we would seek out legal advice for them through Your Story Disability Legal. Some other people just want to be a part of the solution. They want to be a part of the way and the pathway that will help progress and move the changes along. And lastly, when you're talking to us or liaising with the Disability Royal Commission, there are access to free counsellors and legal advice. And where necessary, we can identify additional services that you may need. And now I'll pass on to Sarah Ward, who will have a quick talk to you about how ADA Australia can help. Thanks, Sarah.
Thanks, Liz. Hi, everyone. Welcome to the webinar. So I'm the Disability Royal Commission advocate for the Gold Coast, and I get the privilege of working with clients and hearing their stories, and it's definitely a privilege, and I respect my clients' confidentiality, so I work very closely with them, and everything that we talk about is confidential. So what we do is we've got on the slide there that we listen, we explain, we support, and we submit. So that's sort of some broad categories there, but if I just give you a feel for how it works on a practical basis when I work with clients. So the clients can sometimes come through our beautiful intake team, or they can come directly from our advocates. And what happens is people will contact our service, and then I'll get in touch with the client after that in their preferred communication method. And then that's the first part, I guess, is that listen. But it's probably a little bit of explain too. So I'll spend a bit of time just running through the details about the Royal Commission, seeing if it's a fit for the client. So we work very client directed. So at some clients might say, once I sort of run through the information of the Royal Commission, that it's not what they want. Most are, they've come to us, so they're interested. But it's also a matter of if it's something that they want to, if they want to make a submission or get involved with the Royal Commission at that point, or whether they want to think about it, come back. So it's always very much up to the client what pace they want to work at, and I always get their consent in terms of sharing information with the Royal Commission or with other services. So that's probably a key thing to note, that it's all about the client. So I think Liz said earlier, it's in the client's words. So it's always in their words. And that's how, when I help them with writing the submission, if they want to do a submission, it's definitely in their words, and we work on that basis because it is their submission, not ours. So that's sort of a bit of an overview of sort of how we work. But in terms of that process, so we'll have the information provision, and if they want to continue with the submission, then we'll look at the best ways to do that. Often what I find working with clients is that it's good to pull together the story, the issues, their concerns, and then work with them on what are the key issues they want to actually bring to the Royal Commission. There's often a lot happening in people's lives, and so it's trying to look at the areas that they really want to focus on. So I often find that it's good to have that time with the client, to sit with them and work through what's happened, what has gone wrong, and what could have been done better. And Liz mentioned earlier that it's about that systemic advocacy. So it's always important, and I emphasise this with clients as well, that the Royal Commission won't actually investigate their particular case, and they can't find services and things like that. So it's not about that. It's very much that the clients are making these submissions for different reasons, and sometimes primarily it makes a huge contribution to the Royal Commission to have all this information coming in for their research and to make their recommendations to government. But sometimes clients get different things out of it too. I think part of it is having a voice, sharing their story, and often realizing that they're not alone. It's other people have had some experiences that perhaps are similar. And it's shining a light on those experiences and what needs to change in the system. So I guess in terms of explaining, listening, they're the sort of things that I do as an advocate. And another area is support. So what I find is that we've got some fabulous services that are attached to the Royal Commission. The My Story Legal is the free Commonwealth legal aid funded legal service. So I usually do refer my clients to Your Story Legal, but that will be down, that can be at various stages of the process, again, very client directed. If the client wishes to get that legal advice early on, I can help them with that, to get that, make that referral. Or probably more typically, what I see is that we pull a written submission together, the client and myself, and then I'll make that referral to Your Story Legal, where they actually, we with client's consent, would provide a draft submission to Your Story Legal confidentially. And then Your Story Legal will provide their legal advice based on that. So I can work with the client on that and sit with them and be in those meetings if they wish. So then there's the Blue Knot Foundation and Micro Projects counselling. So it's providing that scaffolding for the client. So they've got those supports around them, because of course they're sharing very personal stories and experiences. And we're always conscious of re-traumatizing clients. So providing those supports is crucial. I would also say that at any stage, I always say to my clients, at any stage, we can stop, we can pause, you can just decide not to continue a submission. So it's completely up to them. And if it's too much at certain times, and there is, you know, a risk of re-traumatizing, we can just stop and, you know, they can get in touch when they're ready. So it's really important to provide that protection for our clients. And then I guess that next stage is that submit. So once they're ready, I can help them make that submission. And they can also, I guess within that sort of context as well, is they can request a private session. So I can work with them to provide support around the private session. So attending the private session and also putting together some information that we send confidentially to the private sessions team beforehand, so the commissioner has a good record of their background and what's happened to the client. And again, that's to avoid some of that re-traumatizing, so the client not having to tell their story over and over again. So that's something I'm finding that works well, is actually having the story on record in terms of that written submission. And then the client doesn't have to sort of tell that every time. They've told it to me once, we record it. Your Story Legal can read it and then give the advice, the private session, all that information is there. But I guess that's, they're probably the main points I wanted to raise there, Liz. So I'm happy for questions later.
Thank you, Sarah. So following on from Sarah, where we look after for the Disability Royal Commission is we're funded for the Gold Coast City Council area. So that's the whole of the Gold Coast area. We do touch some of Logan City Council, so we can help people who live in the suburbs of Beenleigh, Eagleby, Mount Warren, Windaroo, Wolfdean, Bar Scrub, Homeview and Bannockburn. And also in our central Queensland area, we are funded to help people in the Fitzroy Basin area. Anyone who's outside these areas, you can definitely make contact with you, and we can definitely connect you in with the other advocacy organisations in our network who are funded to help with the Disability Royal Commission submissions. So there's plenty of support there that can be provided if ADA cannot help within that area. So lastly, I'll just put up our contact details. So there are a few different ways that you can contact ADA Australia. The first one is through telephone. The other one is you can email us directly. You can make an online inquiry through our website here. Or if you've got a copy of our A5 flyer, you can scan the QR code and make an inquiry that way as well. So what I wanted to do now was I just wanted to go on into the frequently asked questions. These are questions that we've come across through our education sessions with organisations, peer support groups, or generally getting out there in the community, but also some feedback as well. So I'll hand over to Sarah, who will be able to address these for us.
Thanks, Liz. So yeah, I mean, people are asking different questions as we go through the work with them for the Royal Commission. I'll run through these FAQs that are on the screen. But if people have got other questions later too, I think we've got the Q&A after this. So you may have questions you want to ask as well. So how many people have shared their story with the Disability Royal Commission? The Disability Royal Commission website's got fast facts on it. So it shows you, if you go onto the website, how many submissions. So currently, just at the last time we looked at it, there's 3,355 submissions received. There were 11,530 phone calls, 13 issues, papers, and 789 private sessions. So the website, if you go onto it, has got a lot of information. They've got a lot of their research papers on there. They've got the issues papers. They also set out our schedule. So it talks about the public hearings and just coming up in terms of the public hearings. And again, some of these have been compromised with COVID in terms of their more virtual rather than face-to-face. But the 17th to 15th of December, there's a virtual hearing, and the topic there is preventing and responding to violence, abuse, neglect and exploitation in disability services. And they've got some case studies there. Now you can actually go onto the website and usually you can view the public hearing live. You can see it. So if you're interested in that, that's available. And then the next one, February next year, is in Brisbane. And the topic is the experience of people with disability engaging with disability employment services and working in Australian disability enterprises. So I think that might be of interest to some people. So that's on the website under our schedule if you want to access what's happening in terms of those sessions. So I guess just going back to these questions again. So how long have I got to share my story with the Disability Royal Commission? So fortunately, the Royal Commission was extended. So it was going to end in April next year, 2022, but it's now been pushed out until 29th September 2023. But just note that that's actually when the final report is due. So you can make submissions after that date, but it's probably best to try and get submissions in before then if you can. So that's, yeah, we've got till September 2023. So it's a fair bit of time. And I tell my clients, I say to them, like, we have got time, and that's what, in terms of being client directed again, we don't want to rush it. So you can take your time and step through and really make sure that you're happy with your submission before you put it in. So the next question, how long does it take to share my story with the Disability Royal Commission? So another good question. The key is with the Royal Commission that you can make the submission online yourself too. So you can actually go to the website and they've got an online form you can fill out and send it in. So it can be, a few minutes you could spend on it. But what we do with our service is we provide that scaffolding and that protection in terms of that legal advice and the referrals for counselling. So you can go on and do it yourself if you're very comfortable and you don't want that extra support. So it can be really quick. Typically though, it's really the way that we work at ADA is just client directed at your pace. So it's totally up to you, the client, how they want to work and how fast or short. I've done quick submissions with clients. So we'll pull something together really quickly and shoot that into, well, we'll do the referral to your story legal and shoot that into the Royal Commission. And so that can take maybe a week or something like that. A couple of days, depending on everyone's availability and how it works. And so then with other clients, it can take a few months. So it really depends. Now with something like the private sessions, there's a lead time of approximately 6 months on those. So if you make an application for a private session, that in terms of how long does it take to share my story, it could, you might have to wait that period of time. So so it really is very much, it's different for everyone. And if you want to do it sort of quickly, we can do it that way, or we can we can take more time and work through it with you. Whatever the client actually wants we'll do our best to make it happen according to their needs. How long does it take between a submission and getting a response? So I guess in terms of the actual process, once the submission goes into the Royal Commission, what happens is that the client will get a acknowledgement that the submission has been received. That's pretty quick, so that would be within a day, maybe 2 days, but pretty quick response. And then what I'm finding is that perhaps a few weeks after that, the Royal Commission will actually send out a more detailed email acknowledging the points that the client has raised and their recommendations and thanking them. So it's a more sort of extended response. So and then that typically is the end of that process for that submission. So that's how it's working in terms of getting a response. And the response is firstly the acknowledgement and then the follow-up acknowledging in more detail. That's what I'm seeing. I want to share my story with the Disability Royal Commission, but I am being threatened with violence abuse from my service provider. How can I share my story safely? So, I mean, that's obviously a terrible circumstance. And if there's any risk, threat to life, or there's serious concerns, then of course you need to contact the emergency services, the police, or make sure you've got protection in terms of the violence and physical threats. So, but in terms of our work, really we work confidentially. So we don't disclose any information. So you can come to us and have confidential discussions. The legal service also works confidentially, the Your Legal. So you can also actually ask the Your Legal about what your options are if you are experiencing violence or abuse from your service provider. So they can also be of assistance in terms of what your legal options are. So that's been quite useful for some clients to actually get that legal advice, which is not in relation to their submission itself, but in terms of what's happening to them. And a lot of my clients have really appreciated that support. So I'd say the other thing is when you're actually making the submission to the Royal Commission, you can make it anonymously. So you don't need to put your name on the submission. And there's other ways to protect yourself as well. You can mark the submission confidential. We can help with that. And also within private sessions, all of that is protected as well. So there is some protection there, but it is really important to just obviously think through what's best for you as the client and what you can do. But we're here to provide you with some information and support in terms of our advocacy and direct you, help with referrals where that will also help you out. Who covers DRC advocacy support for the other areas in Queensland? So there's a great group of advocates, the DRC advocates right through Queensland. Obviously ADA have got our areas, but we're also in regular contact with the other DRC advocates. So QAI, Queensland Advocacy Incorporated, provides statewide advocacy. SUFI, Speaking Up for You, and TASK, and PWD, People with Disabilities, are also other services. So if you're not sure about where to go in terms of the support, there is the Disability Advocacy Finder. It's a if you Google that, that's sort of some way to check, but we can also, if you want to call our intake team, they can help with referrals as well. So I think Liz will provide the intake details a bit later. So the last question here, for clients that do not want to talk over the phone, can they make a submission? So in terms of the ways to actually make submissions, yeah, I mean, there's different ways that you can do it. So if you don't want to talk over the phone, I'm guessing that's sort of more in terms of that confidentiality. Again, we can meet you face to face and work through that way. So you can actually, just on the phone point, you can actually make phone submissions to Disability Royal Commission as well. So that question is saying if you don't want to, but so if you don't want to talk over the phone, yeah, we can do written submissions, we can do face-to-face meetings, we can work around that. That's no problem at all. But just to let you know too that you can actually make phone submissions. My experience there has been though that there isn't that advocacy support around that. It's really, if you make a phone submission, they're really recording what you're saying, pretty much word for word, and then just sending you the transcript and seeing if you're happy with it. So I think the advocacy we provide around that is important because we actually work with you on a much individual level. So some people might be happy with that, but you know, I think our advocacy provides a lot of benefit in terms of that support that we can provide and keeping people safe. So I think that was about it on that list. So hand back to you.
Thanks, Sarah. So just going back to what Sarah mentioned with our intake team, our intake contact details are these contact details right here. So it's free call 1-800-818-338, or it's email info, all in lowercase, info @adaaustralia.com.au, or there's our website www.adaaustralia.com.au/disability-royal-commission. And lastly, now that we're end of the presentation, we'll just open the floor to question and answers anyone might have. I do understand that some people may not want to ask their questions in that webinar, and that's perfectly fine. What you can do is you can either email myself directly or phone me, and I'll respond to your questions there. So my details are up here on the screen. Or if you're just wanting some information or information pack sent out, then you can definitely contact me directly. So my contact details are elizabeth.sadozai. My surname is spelled SADDOZAI @adaaustralia.com.au. And my direct number is 37362060. So I'll just stop sharing the presentation now and open the floor to anyone who may have questions there. Okay, just have a quick look. Does anybody have any questions at all? Just pop them in the chat.
Liz, just while we're waiting on questions, I'll just mention too that the way the Royal Commission is described, the violence, abuse, neglect and exploitation, are quite emotive words, they're quite strong words. But just to let people know that the terms of reference of the Royal Commission are so broad and they do want to hear people's experiences. So I'm also happy to, you know, if people are not sure whether their issue is in scope, really just happy to have a chat and speak to them, and we can give them some guidance on that, because it is, yeah, they seem very daunting, I think, those words, and it's not supposed to be daunting. It's supposed to be they really want to hear the stories. So they're very receptive, and I find my experience with the Royal Commission staff, you know, going to private sessions, is that they're so friendly and accommodating and receptive, and they really want to hear people's stories. So there's, there may be reasons people don't feel like coming forward. It is quite confronting to be talking about it, but we're here to provide the support and do what we can to help them make it not as confronting for them, I guess, but very respectful of what they really want to do and whether they're comfortable to share their story. So don't be put off by the words, I guess. We can talk to you and see if there's something you're comfortable to share.
Thanks, Sarah. We do have a quick question. So we have a question here. Does the NDIS Royal Commission want to hear about individuals with terminal cancer who had a year without assistance when moving between NDIS and the system for people over 65? So I'm assuming you're talking about the My Aged Care system transitioning from the NDIS into the My Aged Care system. So with the Disability Royal Commission, they're interested in everyone. It's not age restricted, because there's an understanding that disability is a lifelong situation. So it will follow you through your life. It also understands that you might get a disability, later on in life. And, then you're at a point where you're just approaching the My Aged Care system. So they still want to hear from people at any age. And it would be worth hearing from people, especially in that circumstances with terminal cancer, and the fact that they had to go without assistance for that.
And I think absolutely that interplay with NDIS and palliative care. Like, I have had a situation in the past working with a client, and it was kind of their palliative care needs were passed on to the health system. NDIS wanted to clean their hands, and it's that lack of flexibility and understanding that they're trying to separate the disability from the medical, and there's no leeway with NDIS. And I think that's definitely something that needs to be brought to the attention of the NDIS, because it goes hand in hand. So a submission would definitely be helpful in that situation. Yeah.
Does that kind of help answer the question for you there, Paula?
So was there other queries that we were going to answer, Liz? I think some came up through the Eventbrite. When you registered for the Eventbrite, there was some questions that did come up that we just wanted to briefly touch on, because hopefully we can send out this recording to people that weren't able to attend that still had those queries.
So I know we did have a concern about invisible disabilities, and it's important to understand that disability is a disability, whether it's something you can physically see or whether it's invisible. And it doesn't matter what a person's disability is, it's still a form of disability. And we encourage people to share their experience or story. A lot of the time, we do hear situations where a person does have an invisible disability and they are judged, or assumptions are made about their circumstances. So we, again, reiterate that is something that definitely should be shared with the Royal Commission there.
Mm-hmm. There was one question regarding possibly to have a review and overhaul of the support wage system to prevent corruption and bias in the workplace, because systems lack transparency and protection for vulnerable disability workers. So that absolutely that could trigger on the support wage and the way the NDIS price guide is formulated to protect people that work within NDIS as support workers. That's definitely something that could be brought up as a concern to the DRC. So it's anything that involves the NDIS that is directly impacting people that are participants, that absolutely could be, submission.
Are there any other questions anyone might have, or anything that anyone might want to raise at all?
I'll just raise something else, Liz.
Yes.
If that's all right. Just wanted to, I guess, talk about services or ability for people from Aboriginal or Torres Strait Islander background or culturally and linguistically diverse backgrounds to make submissions, and that there's translated material on the website for the DRC, and there's also questions in terms of when we make referrals to Your Story Legal, if they're from someone's from an Aboriginal or Torres Strait Islander background, if they prefer a particular lawyer from their background, or whether they prefer a particular gender. So we can request that for them when we make that referral to Your Story Legal. That's sort of another way the Royal Commission's trying to make sure that they're getting submissions from different groups as well. Thank you.
Thank you, Sarah. So I'll just put my contact details in the group chat for everyone. And I'll also just put our intake advocate details as well in there for everyone as well, just to make sure we all have access to it. Okay. So that's been put in the group chat. Please feel free to still continue to ask some questions. We'll stay on the line for a little bit longer and then we'll finish up.
Liz, are you able to, just before we forget, click stop recording just so we've got that saved now?
Yes, I can.
So I think it will skip my mind.